Good evening, and thank you for tuning in to Northern Beaches Council's Big Ideas Forum, streaming live from Glen Street Theatre to your home or wherever you happen to be. My name is Will Rathel, and I'm the team leader of the Community Development Team at Northern Beaches Council. Before we begin, let's acknowledge the traditional custodians of the land on which we meet tonight, whether that's here on the Northern Beaches, across Greater Sydney and the many clans that make up the Eora Nation, or indeed anywhere on this land Australia, and pay our respects to elders past, present and emerging. I'd also like to note that next week was set to be NAIDOC Week, recognising the 65,000 years that First Nations people have lived on this continent, but that has been delayed until November in response to the pandemic. We also have several local councillors and MPs tuning in tonight, so thank you for joining us. Big Ideas is a quarterly forum engaging the local community in the robust exchange of ideas. Over the past 18 months, we've covered a broad range of topics, from mental health to gender equality, ageing well to the importance of the arts. We're here tonight to discuss COVID-19 and beyond, exploring not just the impacts of a global pandemic on our community, but also how our community has rallied together in response to this crisis and where we go from here. All of us have had our lives affected in some way by the COVID-19 pandemic. Most of us have been unable to see family or friends. Many of us have had to cancel travel plans or weddings, adjust to new ways of working, or simply having no work at all. Some of us have lost friends or loved ones. Despite being considered a hotspot in the pandemic's early stages, the Northern Beaches was also home to a number of community-led initiatives that aim to mitigate the effects of the pandemic on the most vulnerable. As is so often the case, this crisis has drawn out some of the best of us, shining a fresh light on the importance of neighbourhoods, compassion and community. As we look to the next stage of the recovery, what lessons can we learn from our time in lockdown? How do we maintain this increased community connectedness, cohesion and compassion as we return to a post-pandemic society? We will first be joined by Dr. Norman Swan, host of the Health Report and the ABC's Coronacast, to discuss the pandemic and what the next stage of the recovery might look like. We will then be joined by a panel of experts to discuss the broader effects of the pandemic on the community, how we've responded, and where to from here. We will then open up to questions from you, the audience. You can start getting your questions in at any time using the Q&A button on the bottom of your screen. Dr. Norman Swan is Australia's most respected health journalist, broadcaster and commentator. He's emerged as the principal health correspondent during the COVID-19 pandemic and is regarded as one of the most trusted voices in the country on coronavirus. He hosts the daily ABC podcast, Coronacast, and also hosts the Health Report on the ABC's Radio National. Norman has won many awards for his work, including Australia's top prize for journalism, the Gold Walkley. Norman, thanks for joining us.
Pleasure.
Norman, to begin, let's start looking at the figures from comparable countries like the US and the UK. It seems as if Australia has done relatively well in containing the spread of this virus. Why is Australia tracking better than many other countries?
I think that, well, I think it's two or three reasons why we did well. If you look back, well, first of all, we closed the borders to China early. That probably reduced reduce potential infections by a large amount. And we did that beginning of February. First case, recognized case in Australia, which is another issue, but we had some before that, 25th of January. So we're just a little over 5 months. And we closed borders quite soon after that to China. We should have probably would have been a slightly better position earlier if we closed borders to the United States and other countries earlier than we did. But China was the big one. So we got in early. And I think that business and the community rose to this. So there's an academic a public health academic at the Australian National University, who is one of the few public health academics in Australia who's actually done work on the ground in controlling pandemics, Kamalini Lokuge. And she argues that there's never been a pandemic controlled by a government. Pandemics are controlled by community, which is why this webinar or webcast is so important, because it's communities who do it. And if you look at the history here, business got in early. Before government started talking about this, business, particularly large corporations, started to say to people, we've got to work from home, we've got to get ready for this. And they got in. And then the community started physically distancing and doing the right thing almost before they were asked to by the government. So there was kind of a movement. And I think it's a great credit to Australia, to Australian culture, that we did this. And so there was the door was a kind of ajar. And then the next group of people who really got in were the state governments and the territory governments. Because in this country of ours, it's the state governments who do stuff. They're responsible. So if things go pear-shaped, they've got to pick up the pieces. The federal government, God love them, don't run anything. I mean, they run the defense force, the universities and so on, but they don't actually have experience running anything. Good at policy and good at macroeconomics, but it's the states who do things. And the states got on board, and the premiers, regardless of their political party, provided leadership. So here in New South Wales, Gladys Berejiklian was fantastic and still continues to be. Yeah, you can always criticise around the edges. Dan Andrews, unfortunate situation in Victoria, but Stephen Marshall, they all did well. And they got on board, and in many ways they forced the federal government's hand. Early on, there was quite a considerable wobble in the government. My understanding is the Prime Minister was getting economic advice: don't lock down, don't go mad. You'll do more harm than good by locking down. And I don't know how close we came, but I think we could have had the Swedish model. But the answer is we didn't. And the Prime Minister has provided great leadership, Chief Medical Officer, and so on. So essentially, we've had largely an evidence-based approach. And it takes courage to do that, because you've got to go in hard and you've got to go in early. There are no prizes for not doing that, and beg forgiveness later. Begging forgiveness for saying to people, I made a prediction on the 16th of March that it wasn't me, it was a group of experts in the area who were not part of the government's advisory group, who were saying we need to lock down. And in fact, the World Health Organization was saying we needed to lock down. And I predicted that I would be attacked by the shock jocks in 6 weeks' time because nothing happened. Because when prevention works, nothing happens. Well, it only took the shock jocks 4 weeks to start attacking me. So in theory, we will never know how bad it could have been. But we actually do know. Because if we were like Sweden, between 10 and 20,000 Australians would have died, rather than just over 100. And I say just, it's not just. Every single one of those deaths was a tragedy, but it's a tiny fraction of what. So in the beginning, the countries that had experienced SARS-1, were on top of it because they knew this wasn't the flu. They had experienced SARS. They had prepared for it. They had gamed it as a nation. They knew what they were going to do. And so Hong Kong, Taiwan, South Korea, Singapore dropped the ball, but by and large, they got onto it very early. Taiwan's had a handful of cases. I mean, we've had several thousand. They've had only a handful of cases because they got in early. For every day you delay getting in, it's a week extended at the other side. Every day equals a week and more deaths. So now we and New Zealand are considered the world leaders. We've used the fact that we are an island, and islands in terms of New Zealand, or islands for us too, Tasmania, sorry. But we've taken advantage of that. And we've locked down, we've physically distanced. The only thing that works, and it's the only thing that's worked for hundreds and hundreds of years, is physical distancing. What you're seeing in Melbourne at the moment with ring fencing, that's an ancient technique that goes back to the Black Death. It was easy in the old days when you had walls around your village and the city. You could lock down and the whole place was locked down. But it was pretty rough in the old days. They would nail your door shut so that you couldn't get out. What you saw in Wuhan, unfortunately, in some situations. We've managed to do it without that.
Let's turn to the States and Victoria in particular. Several Victorian suburbs look like they'll be entering lockdown.
Can I just say something about, I'm sorry to do this.
That's right.
Very rude to interrupt the host. But the You asked about US and UK. They just waited too long. They waited weeks. If they'd done what we had done, Britain could be where we are. Their set of islands, they could have closed the borders, they could have got in early, and if they had done that, even though there's 60-odd million people there, they would be at a situation just like us, round about now, with almost no virus in the country. Yet, they've got something like the third highest death rate in the world, or something, the number of deaths, I should say.
Sure. No. Turning to the states and Victoria, looks like several suburbs might be returning into lockdown. Is what we're seeing there a second wave?
I'm not sure it's that helpful to think about waves. It's a term that comes from influenza. And this isn't influenza. So what happens with influenza, a lot of people get it. There's quite a bit of herd immunity or natural immunity, but then the virus comes back, pardon me. Also, the influenza virus mutates quite a lot. It's a second spike, and it could become quite a large breakout, which could get out of control if they don't watch out. Second wave, you can call it second wave if you want. It's not yet a second wave, but it's not far away, and they are worried in Victoria.
Sure.
Just remember, what happens to this virus, and it's easy to forget this, and you get complacent, and I don't think a single person in the New South Wales government who's complacent about this, is that uncontrolled, the virus spreads from one person to 2.5 other people. In Victoria, in the hotspots, at the moment, it's one person spreading it to 2 others. Now, that's a doubling rate. So any primary school kid can do the doubling. When you're doubling like that, you get to very large numbers very quickly. And so, and what I say to people is, in November, which is like 8 months ago, 7 or 8 months ago, whatever that is now, there was only one person in the whole wide world with this disease. And now, as we speak today, well over 10 million, soon be 11 million, probably 10 times that number of people are actually infected, 500,000 deaths, probably well over 1 million deaths in reality from one person.
So referring to that doubling rate, how likely then do you think New South Wales is for a return of restrictions in light of what's happening in Victoria?
There's probably still virus circulating in New South Wales, and you've seen the situation as we speak tonight. Allegedly, there's a case of somebody who, in quarantine in Victoria, has brought the virus into Australia, might have spread it in a supermarket. This is what happens. So you cannot relax your vigilance at all. And it remains to be seen from that one patient zero, if you like, case zero, New South Wales, whether it spreads. New South Wales has been really good about controlling this. There's a slightly better system in New South Wales for organising the health system. In Victoria, well, let me talk about New South Wales for a moment. People kind of know this, but there's area health services. So we're in the Northern Sydney Area Health Service, and that's a health service, really big. So it goes from the beaches, North Shore Hospital, right out to Hornsby. So it's a really big area, and with several hospitals. But the important thing is not the hospitals, is that the service provides services for a population. So it sees itself as a population and a community, and it has its own public health people, and there are people who work in this area, who work in Hornsby, who work around North Shore and so on. And there's an infrastructure at a local level. There is very little infrastructure at a local level in Victoria. They're very proud of their standalone hospitals, 84 of them. The rural ones tend to have some population responsibility, but not in the city. And they're suffering from that. So we've got much more public health capacity in New South Wales, as indeed does Queensland, and probably WA as well, because it's stuff on the ground that counts. And I think they're suffering at the moment from that. I'm not saying that's the cause, but they're a bit underpowered.
Turning things really local, referring to Northern Sydney and particularly the Northern Beaches, Manly and Dee Why were identified as hotspots early on in the pandemic, but then it obviously didn't seem to eventuate. What would you anticipate were the reasons why we avoided an outbreak of any scale like we're seeing in Victoria for this area?
Testing. What I was coming to, when we went to physical distancing, which is the only thing that works when you've got a pandemic growing, But what you've got to have, see, what we didn't have in March through nobody's fault, it's just we didn't have it because nobody expected this, is we didn't have a testing infrastructure in place. If you remember those days, we even ran out of tests at one point in certain parts of Australia. So we didn't have a testing regime in place. When you want to come out of lockdown and you've got rid of a lot of the virus, you need a massive testing infrastructure there in order to be able to control little outbreaks that occur, because they will occur. So what happened here in the northern beaches, well, the southern end of the northern beaches, and what happened around Bondi, and remember, and in fact, they were much more successful on the beaches than they were at Bondi. So it was just really hitting it, coming in, massive testing, contact tracing, getting on top of it, just shoe leather, hard work. There's no mystery about this. And unfortunately, in the eastern suburbs, it got out. So it wasn't just Bondi Beach. It got into the surrounding suburbs, and and the eastern suburbs continued for a while to be a hotspot. And some people still worry there might be some virus circulating in the eastern suburbs. So nobody can rest on their laurels. And as much as people in Manly love to look down their nose at Bondi, be careful.
Sure, no, we'll take that on board. So what does the roadmap look like from here? Is social distancing here to stay, and what might that look like?
So it depends what happens with the virus and what happens with borders internally. So if you live in Western Australia or Queensland at the moment, with the border, well, Queensland's opening up, but let's say, if you live prior to the border, they had no virus, which means you can do anything you like. It's like New Zealand. You can go back to normal. You can have 14,000 people at a basketball match, 80,000 turning up to watch the Dockers play, etc. So you don't need physical distancing when there's no virus around. But remember, it only takes one person arriving in Perth and the quarantine to break down I think they've had one case like that in WA, for it to start spreading in the community. So you might not know. So we've all got to be, it'd be dangerous for us to give up totally on this notion. So in New South Wales, so where we live, let's just talk about where we live. There's still virus circulating. We might get down to zero spread. And, we hover around that at the moment. That means that you can really start opening up the economy and getting back to something like normal. The problem is that if you start, the virus is still around, and you can't let up completely. So if you can avoid crowded areas, you probably should. It's just, there are no prizes for being wrong here, and there's certainly no prizes for being right, because being right means that you're keeping a lid on things. So I just think that for a while yet, we've got to maintain social distancing, particularly in New South Wales, where there almost certainly is virus around, because you've just seen what's happened in Victoria. You get into this false sense of security, and it just takes one or two people. And for young people, they looked at the numbers, they're not stupid. Young people don't get a serious disease as older people. But when thousands of people get infected, as they can very quickly, just remember, in parts of Italy, the cutoff age for whether you got a ventilator or not was 40. Not 80, not 60, but 40. Because when large enough numbers are infected, lots of younger people do get quite ill. It's unusual, but so you need large numbers. And just there's the stories from the United States, from New York, I should say. Lots of younger people dying. And that's where we could get to, and we could get to quite easily. And 45% or so of the infections, they're talking about younger people being a kind of new phenomenon. It's always been pretty much the largest single group getting infected, and they don't know they've got it. They either got mild symptoms or they've got no symptoms at all, but they spread it. And asymptomatic people have got just as much virus as people who are symptomatic. And so you just need a bit of an outbreak, then it goes underground, because if you're in a cohort where you're just mixing with other people of your age, it might not be noticed that you're just circulating the virus. Then you've got quite a large population with it, and then it breaks out because you go and visit your granny or what have you. You come out of your cohort. So it's your social network. So it's, people talk about super spreaders, and there are some people who super spread, but it's more people who've got large social networks. So if you're very social, you've got big families, and you get together and you got it, you're more likely to spread it. If you're somebody who's a bit more isolated, and that's not something that's a good thing to be, you want to be connected, that's what this is all about, is social connection, really important. But if you go home and you're by yourself, you could have a really bad case of the virus with producing a lot of virus. You're not going to give it to anybody. The virus will disappear and you'll come through it not having passed it on. A relatively small number of people pass it on to a large number of people. And it needs a cluster, and the home is where it spreads from. Families are where it starts. Weddings, funerals, and you and I are sitting like this. But we're here for an hour and a quarter. And we're in a reasonably well-ventilated area. But social distancing starts to lose its effect when you're indoors with people for an extended period of time. So you can say what you like about, okay, you go to a wedding and you should socially distance. Yep, that's great, and so on. But just being in the same room as somebody who's infected for long enough, they're just breathing in and out. Now, so if they're just breathing and nobody's talking and it's a silent affair, fine. But then at a wedding or a birthday party, people are laughing, they're talking, they're singing happy birthday, and it's, if I had the virus, you'd have it by now, even though we're socially distancing, because I'm just pushing out, aerosol the whole time and eventually get it. And if I were to sneeze, that goes 8 meters in about 2 seconds. Fine outside, indoors, you spread it.
So probably a question on everyone's lips. How far off do you think is a vaccine?
Nobody knows the answer to that question. There are lots of barriers. Very hard to produce a vaccine to a respiratory infection because the immunity in the mucosa and the surface membranes around the throat and the nose is not very good. And the virus tends to get in, and then you rely on the body's immune system to try and get the virus. So the influenza vaccine is a poor vaccine. 50 or 60% of people are covered. It's the best we've got, and you certainly should have it. It's likely that if we do get a vaccine for coronavirus, it's not going to be 100% effective. Probably going to need it annually from now forevermore. And but the Sars vaccine had a problem for SARS-1, which is that when it was given to monkeys, and the monkeys were challenged with the SARS virus, they got a very vigorous immune response, a bit like the SARS disease. And so they're worried that you get this enhanced antibody effect. So the good news is that the vaccines that have been studied in safety trials look safe in terms of the vaccine, but there's not been experience yet, very much experience in those people being exposed to the virus to see whether they get into trouble. There's a vaccine from Oxford University which looks quite promising. It's probably going to be some of the old-fashioned vaccines that use the viruses to get into the body and stimulate the immune system are going to work best and be cheapest to produce. The good news about the Oxford vaccine is that it's produced with public money and it's going to be shared, whereas the American vaccines, given there's a movement for American first, will probably not be shared internationally. They'll be used. So there's going to be a problem there, but I think there are enough vaccines. So the success rate of vaccines overall is about 5 or 10% survive research. And we're compressing this into a year rather than 10 years of development. So 120 vaccines, surely we're going to get 5 out of it. But when? Nobody knows.
Sure. And how about face masks? In Australia, we haven't seen a huge take-up in face masks. How helpful is it to wear them for stopping community transmission, and should we be doing it more?
Well, I think that they should be wearing them in Victoria in those hotspots, and they should be wearing them indoors. Outdoors is less of an issue, but if you don't wear them outdoors, when you go on a tram or a train, you'll forget to put it on. So you put it on when you go out. So a properly constructed mask, so if you're doing it yourself, a triple layer mask with a waterproof material on the outside and then 2 layers of dense cotton tailored for your face that you can wash, or a surgical mask. It's not there to protect you. It's there to stop people who are carrying the virus, they don't know they're carrying the virus, spreading it to others. So if you're trying to, it perplexes me in Victoria, they've ring-fenced those suburbs. They should be insisting on masks when they go to Woolies or Coles or Aldi, and because that will reduce the risk. So if you're carrying the virus, it will reduce your chances of transmission by about around 70% if it's a surgical mask or one that I've just described. And it should be used. In New South Wales, there's probably not enough virus around to make a difference. Although I would have to say, I'd be a bit nervous going to see a movie without a mask on. But you know, if I'm the only one wearing a mask and it's a surgical mask I can breathe in, I'm not protected really. So in New South Wales, we could have probably opened up earlier if we'd allowed masks. We could have probably got the economy going. Because with very little virus around, we could have probably had cinemas open a month ago. And we could have probably gone back to full-blown football matches a month ago in New South Wales if we'd worn masks. It's easy for me to say that, but it's a logistic issue. You've got to have enough masks around, and there are probably enough masks around, and people can make their own. And and again, the physical distancing on public transport. We could have had full buses probably if you'd been wearing masks. So masks allow the economy to get going sooner. Anyway, we didn't do that, but we're getting to a pretty good place. And there's probably not a strong reason for masks in New South Wales at the moment. But if Balmain gets an outbreak from Woolies, using tonight's news, then you'd want to have everybody in Balmain wearing a mask because you don't know who's got it or where those people were, where they live. It's how much virus is around relative to that. Sorry, it was a long answer.
No, that's all good. How long do you think health implications of the pandemic might last?
Health implications.
Now, is there a backlog of people avoiding interacting with the health system? And will that have impacts for health outcomes down the track?
It's hard so you can't generalize here. So people thought, oh, well, at the beginning of the pandemic, people with heart failure, for example, they're going to really suffer in this. In fact, they haven't, is my information, is that telehealth has helped here a lot. GPs have been able to interact with their patients when they've got some of these chronic diseases, and probably in some ways help them more than waiting for an appointment for 2 weeks' time to see them. They've been able to modulate their patients' behavior and compliance and so on. So I think people with heart disease have done quite well. There's probably going to be exceptions to that. The cancer is the one that people are worried about, that people haven't been going for screening because of physical distancing. People haven't necessarily been coming forward with symptoms and keeping themselves to themselves. And if you look at the cancer registrations for the first 3 or 4 months of this year, they're down on last year. So that means we are not getting as many cancer diagnoses as you would expect. And the worry there is that people will be diagnosed later. So in other words, it's not that people stop getting cancer, but they may have stopped getting diagnosed early. And that's a serious issue, because if you look at New South Wales, we who live in cities do better with cancer than people who live in rural areas. And people say, oh, well, that's because we've got North Shore and we've got the Beaches Hospital and what have you. That's not the reason, actually. The reason is that you get diagnosed later in the country than you get diagnosed in the city. And so that's the worry.
Before we invite the rest of the panel up, just one further question. Australia's initial response primarily framed the pandemic as a public health issue. Now we're seeing the government shift its focus to the economic impact. Are we getting the balance right?
Well, in Victoria, clearly not. You've got to be very, very careful. So it's true that the economic impact will go a long time. But let me just say that the modelling from the 1918 pandemic, which is the last time we had a pandemic where we had no vaccine and no treatment, when you look particularly at the United States economic data, the cities that locked down early bounced back faster economically and bounced back better. So not just a bounce back, but they recovered, their economy recovered. So we could well do better than you expect in Australia, because we locked down early, didn't have that huge societal disruption, and we just watch what's happening before your eyes, which just explains it in the United States. So they locked down, they got all the economic hardship of a lockdown, but they came back too early, and they're locking down again. The economic consequences in the United States are just enormous from not doing the right thing in a public health way. And they're not going to be able to retrieve it. It's out of control.
Thanks, Norman. Let me remind you as well that you can use the Q&A button on the bottom of your screen. Let me now introduce our broader panel, and thank you for joining us here together this evening. Lucinda Brogdon is the chair of the National Mental Health Commission, who have been strong advocates for maintaining social connection during the lockdown. The Commission has contributed to the #InThisTogether campaign, along with a number of mental health services and advocacy groups. Welcome, Lucinda.
Thank you.
Greg Jones is a former principal of Mona Vale Public School and an executive member of Community Co-op Northern Beaches, a local initiative that has delivered food to hundreds of vulnerable people across the Northern Beaches over the past few months in response to the pandemic. Welcome, Greg. And finally, Dr. Sean Turnell is Associate Professor of Economics at Macquarie University. He is a former senior analyst at the Reserve Bank and is a key advisor on the COVID-19 economic policies to a number of international agencies and governments in Southeast Asia. Welcome, Sean. Let me direct the first question to Lucy. Social psychologist Hugh Mackay recently said that we are in the midst of two pandemics, coronavirus and loneliness. Can you tell us a little bit about the In This Together campaign and the effects that social isolation has had on our mental well-being?
Thanks, Will. There's actually a lot in your question. In This Together was initiated out of the National Mental Health Commission, working with about 15 of our big mental health NGOs and a number of expert advisors, recognising that we had to quickly move from looking after the roughly 1 in 5 Australians with mental health issues to 5 in 5 Australians. And so it was about providing tips and strategies for the whole population to get through this time of being physically distant from one another, but finding ways to stay connected, because we know social connection is really important, and loneliness was a big issue. As Norman said a couple of times tonight, there's not a lot of good pandemic data and research out there, but one of the things we did know out of the SARS research was that our elderly were going to be particularly vulnerable in this lockdown environment. And so we needed to find ways to encourage people to connect. One of the great outcomes that we'd like to think that In This Together had was that the ABS reported that around 2/3 of Australians reported during the period of lockdown that they were assertively and aggressively reaching out to family and friends using telephone, video conferencing and other messaging. And we actually think that's been a really strong safety net for a lot of people in this time.
Mm-hmm. Have there been particular kinds of mental health services experiencing an increase in demand over the past few months? And what kinds of supports are out there for people who have been struggling during this time?
Look, it's been a really testing time in Australia, and it's not just been the coronavirus time. If we step back, we've gone through the incredible bushfires, we went through subsequent floods, we had the drought for much of last year, and now coronavirus. So this has been a real triple-double whammy for many communities. Lifeline, for example, saw their calls this time last year at around 2,500 calls a day. Off the back of the fires, that started to go up to near 3,000. With coronavirus, it was well over 3,000 calls a day. Kids Helpline was reporting much the same magnitude of increase. So, you know, our crisis services were certainly experiencing increase. Our GPs were telling us they were getting increasing inquiries on the telehealth platform and face-to-face from people feeling genuinely scared and anxious. The ABS told us that anxiety was up across the population. What we did see was a slight decrease in presentations at ED of people in distress. And as Norman said, that might have been really motivated by fear, and we think there's an element of that. But also we were hearing from people that live with quite complex mental health issues that actually at this time their family was able to give them a lot more time and support than perhaps they'd had in the past. So some ups and some downs, but certainly an increase in distress across the population, which is to be understood, but something that we hope we're managing in our communities well.
And good to draw out, like you said, a lot of the ways that family and friends have been reaching out in really positive ways
Yes.
to, again, curb this as best as possible, and obviously showing the benefits of the social connection and cohesion. Sean, Australia is officially in a recession for the first time in 29 years. With JobKeeper, JobSeeker and New Start funding boost due to end in September, what do you see around the corner, and what are the options available to the government?
Well, around the corner is very hard to predict, of course. And one of the things I'm always struck with regard to the pandemic itself, but also the economy broadly, we're operating amongst profound uncertainty. So the biggest thing ahead of us, of course, is exactly what happens to the virus. And unless a vaccine is found, we're going to be in a different economic space than we were before. Also, of course, we've got the international economy and all the things going wrong with that. So to a large extent, much of what we're talking about is out of the Australian government's hands. Having said that, there is a large part that is in their hands, and I think they've responded incredibly well, actually, given what's happened. So essentially what's happened, though, the economy, is that it was a deliberate slowdown. What's really different to the past is that this hasn't been a failure within the economic system. The economic system was powering along. We decided, for good reasons, to turn the engine off. So at some point we're going to have to turn it back on again, but we're turning back on a different engine, if you like. So there's all sorts of things that come into that. I think the government likewise responded, I mentioned they responded well, thrown a lot of money in it. About 13% of GDP has been the increase in government spending to compensate partly for the reduction in private spending. That's pushed the budget deficit, be about 9% of GDP, which is off the scale compared to what it was. We were heading towards zero, but it's the right thing to do. At some point, we're going to have to come back and repair some of those finances. But in the meantime, funnily enough, the prudent approach is to keep spending. And so what that means is, really practical terms, September, JobKeeper comes to an end, but I think it'll be replaced with something else. We'll probably get a new name. It might be slightly reduced with a little bit of a nod to fiscal orthodoxy, if you like, but something quite close to that must, and I think will, be put in place.
I'd like to explore the impacts of the extended period of work from home, and Lucy and others might want to weigh in on this as well. A recent survey found that 81% of Australians agree that people should be encouraged to work from home where possible. Employers have been hesitant about working from home in the past. Now that people have had a taste from working from home, is it here to stay?
Yeah, I think it is, and I think tonight is a demonstration of the power of the electronic media and all the networks that we work with. Having said that, though, the limits are there as well. And again, I think everyone on this knows those limits. As we know, human beings are social animals. A lot of work is collaborative. And I think the missing thing is all those unplanned interactions from which innovation comes. So in other words, yes, it's great. It's here to stay, working from home. But I think we will move into something else, but it'll probably be some sort of hybrid, where it won't be unusual to have a couple of days a week at home, or even 3 or 4 days a week at home. But there will need to be some sort of central interaction, I think, for many firms. But that will have transformative effects on real estate and exactly how you organise office space and so on. But yeah, so I think it's here to stay, but some other sort of hybrid model, which may even be better than what we had before, being optimistic about it.
I'm sure many people are hoping that. But
Indeed.
exactly, I'm sure we'll have a few more questions on this issue as well. I'm not so sure.
But don't you think, I'm interested in Lucy's view on this, we tend to jump on fads a bit. So yeah, it has worked. I'm not sure how many people really love it.
Yeah.
And if you're running a business, there's just something different about face-to-face interaction, the body language, and what you get that you just don't get on a Zoom interaction. I mean, we are going, I know Facebook and other things are talking about shrinking their office size, and probably developers are tearing their hair out. But, face-to-face is, we're human beings. I mean, maybe I'm just being old-fashioned here. What do you think?
Well, I think from what we're seeing, people are liking the flexibility of being able to work from home, but are quite keen to get back to the office. the real barrier that they're trying to overcome and the psychological hurdle is public transport. And so I think that's the next conversation. Masks. And it may well be masks, but at the moment, that's the real issue that people are having to psychologically overcome is how do I leave the safety of my home? I know my workplace is doing some great things to be safe, but getting from A to B is my challenge.
Yeah. Let's welcome Greg into this conversation. There have been a number of impressive community-led initiatives in response to the pandemic. We've seen the Viral Kindness Facebook groups, Council's Hello Neighbour letterbox campaign, which was done by many other councils as well throughout the country. And of course, locally here, the Community Food Co-op. Greg, can you tell us a little bit about the Community Co-op Northern Beaches? What drove you to start the initiative and how has Community Co-op responded to the pandemic?
Well, I was heartening to hear the comment that communities are probably best placed to attack the virus and to manage it. And as a group, Northern Beaches Community Co-op wanted to support the community in the time of need. What we didn't want to do was replicate existing organisations because they were doing a great job. And they knew their clientele and they knew the people that they were reaching out to and they had trust. But what we found was that many of the groups weren't connected at all. So Community Co-op Northern Beaches looked to put an umbrella over all of those other groups. And with the support of Harris Farm, which have been providing fresh fruit and vegetables to Community Co-op, which is a fantastic initiative, and we should thank them for that and other organisations, we looked to make sure that those groups that were already working in the community had sufficient resources to be able to meet their need. And it became apparent to me when we had one of the women's refuges say that they needed cots and they didn't have any, but some of the groups that were working with us under that umbrella did but didn't need them. And it was just, I thought, a little bit strange that there wasn't that connectivity between them. So one group had stuff, the other group didn't have it and they didn't know. So one of the aims of Community Co-op Northern Beaches was to connect those groups strategically so that we could share our resources better. I think as a community, what struck me is Australians have been amazingly resilient for a long time. You know, we've had the floods, the bushfires, and every time there's an appeal, Australians dig deep into their pockets, and you just wonder how much longer that they can, how much more money is in the pockets. But we always seem to find that, and so across the Northern Beaches, people were putting letters in, neighbours' letterboxes to say, if you need a hand, I'm here to give you a hand, here's my name, here's a picture of our family. And I think it connected communities a lot better than probably what we had before.
Yep.
So it's been a great initiative. I guess I could frame it by saying we put our hand out to help, but we also are picking people up as well. So we're doing a bit of both. Australians have been great at that, whether they're Indigenous Australians that always looked after their own community to white Australians and the whole community coming together and saying, if you're a member of our Australian community, you deserve to be helped, no matter who you are.
Do you think it will survive the pandemic?
Sorry?
Do you think that connectedness will survive the pandemic?
Look, I think that would depend on what structures we can put in place, because it's easy to forget, and it's interesting we talk about social distancing. Certainly here in Sydney, the tension around going out has relaxed dramatically. My wife's a director of nursing and she's in an aged care facility and I don't enter. Full stop, no ifs, no buts, no beg your pardons. I'm not allowed in, no matter how much I've had, even though I had a flu shot and everything. And so I go to Warriewood Square now, and 6 weeks ago, if I had to go down to get something, people were clearly staying apart. Went down yesterday and there's a sense of relaxed normality moving back in. And I understand the economy's got to chug along because, if no one's got money, then it can be quite difficult. But I think that we've relaxed fairly significantly, and I think that that's an area where I think you made the point, we need to still be extremely cautious. My wife tells me the virus hasn't changed, has not changed at all, but we have. And Victoria are now seeing some of the results of the fact that they've said, everything's all right now. And we need to be, very, very careful, particularly given our elderly population when it gets into it, are the most vulnerable. And so it's been great to go around and seeing younger members of our community who've never done any volunteering, and we've got 60 volunteers providing cans of food, sending it cooked meals to the elderly and needy. And there's a whole group we don't know about. There were backpackers that were stranded here, couldn't get home, that had no support mechanisms at all. So we've been able to provide food and comfort. So yes, beyond, I think if the structures are right, we map the provision, and there's I would say, a hub, particularly if the council would sponsor, a hub mentality where those different organisations can come in and say, we need this, and there's a sense of somewhere where there's a group that, can come together.
Thank you, Greg. Before we open up to questions from the Q&A, I might ask one more question to Greg and extend it to everyone else as well. Building on that point, I guess, about how we maintain or build upon this sense of social connectedness or cohesion that we've been witnessing. What are kind of the tangible ways that we can sustain it, as we progress through the pandemic and even beyond, whenever that point might be?
Well, I think that hard times are often forgotten when the good times come. It's very short-lived. So we need to now look at what are we doing now that's effective. And the thing that we're doing that's effective is we're linking those groups in the community that have their own structures. And we're saying not only do you work within your own little structure, but you're also connected across. So it would be my view that we would set up a community hub where those groups could say, if it's a women's refuge or a group supporting the elderly, and a lot of church groups that provide support and food to the elderly, that if they need anything, that they can email into the hub and say, this is a resource that we need. And if another group that's servicing the community have it and it's excess, they can provide it, or the community Northern Beaches can source that gap that's there to provide it. And I think that would be a more efficient way for those community groups, because what we don't want to do is let government take control of those community groups, because then it's not a sense of community. And I think what I've found is that when communities look after each other, it's more powerful. And the one thing I would say, the groups that we're supporting don't get any government funding. We made that very clear at the beginning, that there were groups out there that get significant government money to support their endeavours. We were supporting those groups that have no government funding. So we're strengthening that connectivity at a very grassroots level.
Thank you, Greg. I'm not so sure if anyone else wants to add anything there, but again, noting that there's a role to the market, a role to the state, but again, that role of civil society is absolutely critical.
And that role of civil society is so important to the well-being of the population. If people feel that they can contribute, and a lot of them have lost their opportunity to contribute through the paid work, but they can contribute to their community, we see their well-being improve and the levels of distress go down. And so whether they're participating in co-ops or surf clubs, and there's so many opportunities in our local area to participate, it's been quite wonderful. Lifeline, for example, are reporting that even though call volumes are going up, their counsellors have got more time on their hands, so they're actually being able to put more people onto the phones to take that. And so we're seeing people respond in incredible ways. We've got incredible volunteers through Community Care Northern Beaches doing assertive outreach to our elderly, and they got 100 volunteers almost overnight. And I think it's essential that we actually find ways to maintain that, because we know our elderly are so isolated. The majority of older Australians actually don't live in facilities. They live alone in their home. And it's important that we give them the well-being and the dignity and connection that they deserve.
And this sounds like some soft, nice to have. There is solid research behind this, going back a long way, that you ask somebody, how many people can you call upon? If you're in trouble, who can you call upon? Do you have one? Ideally it should be 5, that sort of number. Lucy knows far more about this than I do, but that connectedness makes a huge difference. So, and it's not just the elderly. If you look at adolescents, for example, the 2 predictors of outcomes, they're not the only ones, but income starts to fall away as a predictor of outcome, and it's your connectedness. So are you connected to your school? Are you connected to your family? Have you got firm, loving parenting and so on? Those are the sorts of things. So connectedness is really important. Now, if you look at people who, the rise of apps for people to hook up, if you like, is an indication of the loneliness and isolation of younger people. So the more resilient your community is, the more connections there are that are solid there, the healthier and the longer lived your community is. It actually does translate to a longer, healthier life through complicated things that we haven't got time to talk about today. So we've got to use, not just in the Northern Beaches, but everywhere, we've got to use this pandemic to create a much more solid resilience in the community moving forward. Well, there will be other pandemics, we'll be able to resist them, but that's not the reason for doing it. The reason is that we live healthier, longer lives when we're more connected.
Yeah.
And it's not an easy thing to do.
Yep.
Well, it's opened up our communities, hasn't it? For many, we've gone to work, gone home, shut the door, and knew we had a neighbour, probably knew their name, might have waved, which is certainly in our area, and now there's a much more connectedness between the groups. And the kids are playing in the street and they'll say hello, and there's a neighbour down the road that we've been there 20 years, which I hadn't met before, and now I know him and I say hello, and he's a single older gentleman that's wife's passed away, and you can see he's almost got a new sense of energy. And it's because the community are now talking. It's a bit like going back to the 30s, 40s and 50s when a neighbourhood knew a neighbourhood and we all looked after each other before the days when we looked at a phone to be connected.
So the city that I come from, Glasgow, originally, is a good example of that. So Glasgow has the worst coronary heart disease rate in the world, actually, apart from parts of India. Terrible life expectancy and so on. The life expectancy gap in Glasgow between the longest lived suburb and the shortest lived suburb is 25 years. Huge. And people say, oh, it's the the fried Mars bars and the haggis suppers, and so on, and all the smoking rates. When you actually look at the lifestyle of people in Glasgow, it's actually not that much more unhealthy than, say, Liverpool or Edinburgh or other cities in Britain. But what did happen in Glasgow is that they had this well-meaning program to get rid of the slums and put people into what we would call housing commission areas. But what they did was they destroyed communities that had been there for decades or hundreds of years. And they didn't recreate those communities. And it was the loss of community, the loss of connectedness, which created excess alcohol consumption, excess smoking, all sorts of other things going on. It was a loss of community connectedness. And people watching this who've been to Glasgow think it was a very friendly city, but it's not nearly as friendly as it used to be when there were effectively slums there.
Thank you, Norman. I think we'll pause on that point as well. It's an excellent one to dwell upon in terms of the importance of community. And what we will do now is welcome it into the audience. We've got many questions coming through, and please continue to let them fly through. Looks like we've got a question here. We might direct it first to Lucy and extend beyond. Many people are delighted to be working from home during COVID-19, but not me. 2 months was fine. At 4 months, I'm totally over it. It's too isolating and I'm zoomed out. My concern is that we will see permanent, compulsory working from home for many organisations in the future. What are your views about the social and wellbeing consequences of working from home long term?
Look, I think we touched on this a little bit earlier in Sean's comments. Human beings are herd beasts. We do need connectivity with each other. I'm with you. I'm ready to get back, and I delight in the opportunities to get into the office at the moment. But I think there are individual issues that we need to focus on, and what we're encouraging businesses to do is really take the time at team level to work out who can't wait to get back in, who needs a bit more time to adjust for whatever reason, and try and accommodate those needs where they can and negotiate some transition back into work. There are a raft of reasons why people might feel a real urge and need to be back in the office, and for others, they just need that safety of home for a bit longer. If you are feeling isolated at home, one of the best things I learnt halfway through the lockdown was you can turn off self-view on Zoom. Best thing ever. You're not looking at yourself for 6 hours in the day, looking at everybody else, but not yourself. But is to find new routines and different strategies and mix it up. At the moment, a day feels like a week, and we recognise that. And so sitting at home on your own, trying to work, you need to create some structured breaks and get sweaty and get some exercise, get some fresh air, and really try and work with your organisation to see how they might accommodate your return to work, perhaps at the front end of that move.
It sounds like the importance of that sustained dialogue back and forth between employer and employee. Thanks for that.
Yeah.
I've got another question here, maybe for Sean. How can we as a community address the social and economic impacts of COVID-19 by building on the positive aspects of the last few months? We've had less cars on the road, less pollution over the last few months. How might this lead us to deal with traffic congestion differently in the future? The option to work from home has also been great for young families. How do we avoid rushing back to exactly how things were? and instead take time to work out what we can change for the better?
Well, I guess with a lot of those things, the last thing you'd want to do is close the economy down to make the traffic better. So to some extent, the worst aspects of pollution, global warming, etc., will visit upon us in a really rapid fashion. We want to try and do it better and less destructively to the economy and to normal life. So yes, there's been some upside, but it's a terrible way to get to it. The other thing, though, that there is a bit of an opportunity, and the opportunity to do what, I think, is up to us. But it's interesting, actually, I think, to compare the moment to what happened in the Second World War, where, for instance, the consumer economy, the private sector economy, was essentially closed down so you could divert resources to the war effort. This time we've closed the economy down effectively to devote resources to fighting the pandemic. So it's interesting, I think, when people talk about the costs of what's happened, comparing it to something like a war, something as existential as a war, which I think this pandemic is as well, I think actually sheds a better way of thinking about it. But just like at the end of World War II, when people ask themselves the question, okay, we've done this, now what? How do we build a better world? We've had all these sacrifices, etc. What's next? And so I think to that extent, if there is a silver lining, it might be just in having that question before us.
Yeah, thank you, Sean.
I think just to comment on that, I think some businesses lend itself, and they're probably moving to that anyway, and the pandemic's just really accelerated the fact that there are certain things you can do from working from home. But much business requires people to be interacting together, to be creative, sitting across from someone, so you see the nuances of their language, their body, language and that sort of thing, and you just don't get it in Zoom. And I think it's quite sterile. I think it's good for the distribution of information, but in terms of a board meeting, I think it's at some point you need to be around the table and you're just getting those nuances.
Yep.
But what we didn't do after the war, Second World War, was we didn't pay back debt. We didn't go into austerity mode. We went into stimulation mode, and we encouraged people, particularly returned soldiers, to get education and training, and created the infrastructure for that. It was the beginning of the growth of our universities. We were not obsessed with debt. And at the moment, debt is at almost zero interest, fixed for the next 30 years. There's no reason to retire debt quickly in Australia at the moment.
Absolutely. But it's interesting on that. And here a bit of a shout out for the economics profession, because I think
somebody's got to do it.
Somebody's got to do it. They've displayed enormous pragmatism about this. We were obsessed with debt 2 years ago when we had none. Now we've got lots of it, and we're much less obsessed about debt. And I think there is a broader understanding. I think underneath all of this, there's been some really insightful, even theoretical work on what exactly debt means. And, debt is one person's liability, but it's another person's asset. So there's a whole different way of thinking about debt, which I think is really productive. And I agree with you, actually. I think that the debt levels, particularly globally, are so big, we know it's never going to be repaid. And so it's just going to be interesting how we exit out of it, how we avoid hyperinflation and things like that, and get into that good space that you mentioned. How do we build a better economy and a better society coming out of this?
Norman, I've got a question here for you. How accurate is the testing that we are using? Is it true that there are large false positive and false negative results? If this is true, how can we ever know if the reported numbers of cases are reliable, or if we're creating unnecessary stress?
Well, the first thing that has to be said is that the proof of the pudding is in the eating. So with the tests that we've brought, with physical distancing, we've brought this pandemic under control. Most states and territories in Australia have no virus. Victoria's got a bit of virus. We've got very little in New South Wales. So that's the first thing to say. So the tests are operating in a good enough fashion, but they've got problems. The false positive rate, so just to explain the terminology here, so false positive means it tells you you've got SARS-CoV-2 or the COVID-19 virus when you don't. That's a false positive. False negative is that it says you don't have the virus when in fact you do. So the false positive rate is tiny, is really small. And if it does occur, it probably occurs because there are lots of other coronaviruses around, common cold viruses and others, and you may get a bit of cross-reaction. And also when there's very little virus around, it's much less likely that you're truly positive. So false positives tend to take on more prominence than they actually deserve. So false positives aren't really worth worrying about. You know, and that football player in Essendon, for example, he was positive because he followed a very typical pattern because the false negative rate is high. So let's say, you know, it's not going to happen, that one of us gets infected tonight. One of us is carrying the infection and we get, you know, and we all get infected tomorrow. But we realize that tomorrow. You get tested and we discovered that you were positive, and tomorrow we get tested. All of us will be negative on the test because there's not enough virus in our body to trigger it. And then that false negative rate goes down. In other words, the accuracy goes up as the infection progresses and probably reaches its most accurate about 8 days after your infection, and then it goes up again, which is exactly what happened to that football player. He was negative, 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 or dubious, positive, and then negative again, probably when he was still positive. So the false negative rate is high. And it means that, for example, if you lose your sense of taste or your sense of smell, or it changes, or you got fatigue, and you come back with a negative test, get it done again. Because, for example, at the moment, if you've got loss of taste, loss of smell, change of taste of smell, you've got COVID-19 until proven otherwise, regardless of what the test shows. The antibody tests, which people have heard about, so blood tests looking for antibodies, really only tell you whether you've been infected in the past. And there are lots of problems with them, and really they don't have any practical value to control the pandemic.
Okay. Got a question here for the broader panel. Does the panel feel that living in outer Sydney suburbs or even regional areas will become more popular places to live as a result of the pandemic? Will people choose to live in less densely populated areas, especially now that they don't need to live close to the office?
Look, I'll have a go at that. I think that might be a medium-term change, but I think we are drawn to be close to each other at some point. It's just within us.
You're not moving to Wellington tomorrow.
I think we might find some people, and some people already have made those choices and moved to different areas, but I think at the end of the day, we like to be near each other, and we'll probably come back.
And at that point too, prices begin to kick in, because if that really became a phenomenon, imagine all the inner city apartments dropping in value, and suddenly people think, oh, okay, the city apartment is now affordable, bang.
Yeah.
So the market itself might be a bit of a corrective on that.
Yeah. Yep.
I think the thing I would hope it would do is that the way we plan urban environments might look to be relooked at. It's clear that certainly in New York, where there was very high density and very difficult to socially distance, and in those areas where there's extraordinarily high density, the virus spreads very rapidly. And I think in terms of planning urban developments, we might need to look at more space around. So I think there will be a shift by some people to believe that, living in the country or working in the country might be actually better for their own mental health, and a whole lot of things for their family. But I think packing people in densely into huge towers potentially is a recipe for disaster unless we manage how those airflows and that sort of stuff works.
It is, however, the most energy efficient city in the
Yes.
world.
Yes.
So in terms of climate change, New York's actually a good example.
Yes.
So you've got to get that balance right.
Yes, absolutely.
Yeah. Got a question here that looks like it's turning to some socioeconomic factors. We might turn to Sean or Greg on this one. The COVID-19 situation has magnified the difference between the haves and the have-nots. How can we ensure we are reducing the gap, and what lesson can we learn from this?
Yeah, well, certainly it's true. And one area where it's happening, surprisingly enough, is in the online workspace that we've been talking about already. So, for instance, one of the reasons why online working is working at the moment is because we're drawing on social capital and connections and all the things we've been talking about that have been established before. And so that advantages workers who've been at a workplace for a long time and have status and power and connections and all that. Young people starting out miss out on those really foundational connections that you need to make. So in many ways, to the extent that the online economy has been working, it's a little bit artificial because we're drawing down social capital. At some point, we're going to have to replenish that by being all together. So even in that world, there's been, I think, a disjuncture and a widening of the gap between the haves and the have-nots. But then, of course, we get into, I think, bigger issues down the track. Being at Macquarie, I have lots of students, and I see them these days just on Zoom and video and all the rest of it. But I feel terribly sorry for them because not only are they getting, again, despite all the good things about the online world, they're not getting as good a experience as they would have otherwise, and they're going to be going into a bad economy. And the data is unambiguous. It shows that if you graduate or if you leave school and you go into a bad economy, that affects you for the rest of your life. It really has a trailing impact all the way through. So just to underline that, yes, this is going to have profound effects, I think, exactly along those lines between haves and have-nots. Now, what to do about it then, we get back into the issues that we were talking about before. I'm a little bit confident again that I think that there's sufficient recognition that this is big enough, that government has a really strong role here, and this is, I'm really perhaps going on too much about it, but it seems to me that there has been a dramatic change in the mindset of a lot of policymakers on this, so that what's needed to be done at the government level might actually just happen. So, but it does, again, put the ball back into the court of policymakers and then back to us as people who are thinking and voting and acting. But yeah, serious issue.
I mean, the interesting thing is, I don't know what you think about this, but one of the reasons the government's performed so well and done the right thing is they realise that they're the ones who created the lockdown, and therefore they're morally bound, as well as a sensible economic policy to actually provide that backdrop, because it's them who did it. And I just wonder whether that's going to spread to realise that a lot of things that governments do have that impact. It's just a slower burn. And whether they realise that, in fact, you can tend to get this sort of Ayn Rand view of the world where there's no role for government, just the police force, the defence force, and everything else should be left to the marketplace. To start to realise that what governments do have a profound effect on the way we live, not just in pandemics.
Yeah, I think it's absolutely right. Norman, the other thing I think which is sort of underplayed a bit is the role of the GFC in all of this, because global central banks suddenly, they knew what to do. So we had partly a replay. Like famously, I think it's been observed that what we're experiencing now is a mixture of Spanish flu, Great Depression, and something else that I can't remember.
World War III.
Yeah, all of them put in together. But it is amazing, I think, that if you like, the policy-making muscle memory within central bankers, we've got, for the first time in a long time, the same generation that experienced the global financial crisis, and the way in which government had huge agency in making it better was suddenly revisited. As I say, again, within that same generation. And coupled with, as you say, a responsibility, they're the ones who turned the engine off, I think has meant that, the government response, policymaker response is so different.
And I think, taking Norman's point and your point, Sean, what we've seen is through models like National Cabinet, agencies working together to problem solve very quickly that have traditionally not had to sit at the table together and solve problems around getting meals out to people. How do you get the NGO community activated to move into spaces? And I think then starting to actually appreciate, and we're seeing this in the suicide prevention space, that suddenly we've got education, employment and others saying, oh, I've got a role to play here. The policy that I design actually has either a proximal or a distal impact on someone's well-being. And maybe some of the things I'm doing are not helpful and I need to address those, but I also do have a role to play. And it's been quite fascinating to see kind of the scales come off, the windows open and the conversations happening, all out of necessity, but taking a longer term view. Because
the bottom line is we agree on more than we agree
Absolutely.
together, more than we disagree.
Yes, exactly.
And it's great to see National Cabinet coming together irrespective of, the politics, for the goodwill of the Australian community, although there's a bit of a rub here and there, which is just the natural, of human beings working together. Look, I think there's a group of haves that will very soon be have-nots. Certainly the self-funded retirees, I think, is an area that's going to be, I know it's causing a fair degree of angst in that community, and many of them will see their incomes, more than halved, sometimes 75%, because they're based often in shares. They don't get much government support because they're seen to be, wealthy, and people say, well, just sell their shares. Once they do that, that's it, it's gone, and then they've got to be picked up by the government. So I think there's certainly a high degree of anxiety in the retired community, the self-funded,
Yep.
at the moment.
Yep.
And I think that'll lead to some issues around mental health. And I'm
Yes.
already hearing people saying, I won't have enough money, I just don't have enough money to live on, and I don't qualify for anything, and I need your food package. And these have been people that have been looking after themselves and not accessing any government funding or support because they said, I'll look after myself in retirement. And I think we need to make sure we're keeping our eye on that group as well.
And so, and that's one of the things that I'm quite proud of in the pandemic response, is addressing that sense of burdensomeness and shame, and how we get into communities and work quickly and gear them up to do that.
For many of them, they've never taken anything
Exactly.
at all,
Yep.
and they've given all their lives with their taxes and looked after themselves, and now they're extraordinarily worried and embarrassed about even asking for a meal from us, which I think is quite sad.
Thanks, Greg. Next question here. How do we continue to cope with the reality of continuing uncertainty? What next has never been less clear? How can we create resilience and hope for the future? Lucy.
Look, I think it's been said many times, it's okay not to feel okay at the moment. Uncertainty is part and parcel of what we're dealing with. We have to try and break these things down into time frames that we can get comfortable with, one day at a time, 1 week at a time. Think about the things that we can control, let go of things, learn to let go of things. I think that's actually probably going to be a real plus out of this, is that we let go of a lot of things that have taken that cognitive space, and we've started to bring some of the positives into that. And really, I think actually in Australia we've got comfortable with uncertainty for a long time. We've been a rapidly growing country, a rapidly changing country for the last 50 years. And so the pace of change is a little faster, but I think actually we've been equipping our people for a long time to deal with uncertainty. And not a big fan of the term resilience, because I think it kind of makes people think there's something wrong with them. I think we need to actually help people focus on the great strengths that they do have, and that might sound a bit Pollyanna, but you know, our young people have really risen to the challenge of switching their learning modes. People have switched their working modes. Communities have found ways to support each other, and that's what we should be dwelling on at the moment, what we have achieved.
Yep. Thank you, Lucy.
There's two things here. You can look at it at a macro scale. And you're seeing it at a national and state level, where where leaders who are probably feeling very uncertain themselves, so they're living the same world of uncertainty as we are, and yet they've got to kind of present a pathway to us, to the future. And that will help us a lot. And they're trying to do that. And it's not easy for them in a political environment to do that. And you just see how quickly it can shift with Dan Andrews and Victoria, and the sentiment shifts very quickly. So they're walking on a knife edge at the same time as they know that good leadership provides a pathway forward. And you know, my heart goes out to them, because that's what they've got to do, and they're feeling as much uncertainty as we are. I use the word control a lot here, and you know, sitting next to Lucy, I'm nervous in doing this because it's called the Locus of Control. So it's really where how much in control do you feel of your life? I wouldn't pass a psychology exam giving this there. And how pressed are you in terms of you feel pressed by your environment? So a single mother with 3 kids. And you're not able to make decisions about your life because you haven't got money, and your kids are screaming, and you've got to get them to school and everything else, or in a work environment where you're oppressed. So it's that sense of control, and it comes exactly to what Lucy was saying, which is the evidence is that you take control of what you can. So what I heard a lot in the language early in the pandemic was from people who were, say, in their 40s and 50s, saying, because you know, we were getting 8,000 questions a day, but a lot of them were from people in their 40s and 50s saying, I need to decide what to do about my parents. And I'd say, why? They can make their own decisions. You know, they want to go. You know, they shouldn't be hugging the grandkids. But you know, if they've got cancer and they know they've got a limited lifespan, why not hug your grandkids, even though you're told not to? People can make their own decisions. So you can make those important decisions for yourself. And it's important for us as children not to make decisions for our parents or grandparents. They need to have control over what they can have control over. And there could be all this uncertainty out there, but if in your world you can make decisions about yourself and control your destiny, then that's going to be better for you. But what Greg's talking about is really hard, where what you've been used to, which is I can afford to go to Woolies and buy my weekly shopping, and I can't do that anymore. That profoundly shakes that. But if the community can rise to that, but not take away your control and your sense of destiny, that's a really hard balance. But if you can do that, I think that's a very strong way forward. And that's kind of one of the ways that community support operates. What do you think?
Oh, absolutely. And we've seen great examples of that. So, and a lot of it goes on behind the scenes, and people don't want the fanfare. But Greg, you would have known as a school principal the families that were going to struggle more in this environment and others that were going to cope fine. And we're hearing great stories of principals and teachers doing that little bit extra, knowing that there was someone that had a lot of kids at home, you know, we'll make this work for you. Workplaces were doing the same thing. It is a challenge for some people that are off the radar in some respects and that are coming onto the radar. But, you know, I'm encouraged by the fact that we were all assertively trying to reach out and connect to friends and family. And when we're doing that, we can then start to see their changes and shifts, maybe be the emotional mirror for them and notice the change and find ways to connect them to services that they might need, find ways to just be there for them and sit with them in that transition to a new place that they may not want to be, but how they can make the best of that.
People are stronger than you think. And if you look at PTSD, you know, if you can find people, ambulance officers, police officers, who've seen terrible things. And you think, well, they're all going to get PTSD. Well, they don't. Maybe 20% do. So it's a very high percentage, which grows over time. So it's not an insignificant problem, but not everybody does. And in fact, some of the people that you think are the strongest get this. So there's this sense of you can jump to conclusions about it's not about weakness, it's about vulnerability. And you can jump to conclusions too early, and you can also jump in too early. And you've got to creep in on this, because experiences like this do make us stronger. Not everybody, but some surprising stories. I'm sure people watching this have got their own stories of people that you thought were not going to cope well with this, and they've just risen to it, and they've become different people. They're the same person they always were. They were just stronger than you thought. Stronger is the wrong word, because it sounds like you're stigmatizing them if they're not, if they're vulnerable. But it's just that they've had resources that you haven't thought they've had.
My concern's a little bit further. We've got a lot of young kids, and they're sitting at home around the dinner table, and 4, 5, 6, 7, 8, 9-year-olds watching mums and dads watch the television and watch what's happening overseas and constantly talking about it. And every time you turn on a television, and rightly so, there were warnings about don't go here, don't do that. And we need in our homes to remain a sense of calmness and normality. And I coughed a few weeks back, and my grandson, who's 4, said, "Pa, have you got the virus?" And I said, "No, I've just coughed." But they're sponges. And so we as adults can manage this, but we just got to be understanding it. Family, there are little kids around there sucking this stuff in, and they're getting anxious and worried.
I did talkback probably late March for kids. So kids were phoning in live. And they were asking questions about the virus, very intelligent questions, as kids do. And this little boy, who's 8 years old, phoned in from Melbourne and said, are we all going to die? Is all my family going to die?
Yeah.
You know, and you suddenly realize what's going on inside their heads, and they probably hadn't said that to their parents.
No.
It's just...
So one of the things in our tips is to actually have COVID-free time.
Yeah, absolutely.
Have a family conversation.
Turn the television off.
Turn the TV off. Have family meals that or social connections that
Yep.
don't bring that up.
Yep.
But particularly with kids, there's some great resources. Macquarie Uni's got some
Yes.
great resources around having conversations with kids to put some structure to that, to really listen to where their anxieties might be coming from, not to pathologise it, but just to say, this is our new normal for a while. What are your questions? How can I help you? But actually, we're not going to talk about it all the time.
I might give us one last question here up on the screen. There's obviously a lot we've covered there as well to take away. I think lots of people were Googling locus of control amongst psychological flexibility as opposed to resilience.
Lucy could lecture on it.
We have this final question here, and it's a good closing one. How can we take the lessons from these difficult few months, and I think we've already addressed some of these, to advance a society with a greater sense of collective well-being? And the final thing, do you think we as a community will come out of the pandemic stronger?
Good economies and well-functioning societies come out of confidence. And Australia can come out of this, I think, confident that it is rational, reasonable and compassionate. So just that realisation, compared to most other places in the world, once again, I think we've come through a test. That's part of the answer, I think, just having the confidence that we can, when put to the test, can do it.
Thank you, Sean. Greg?
Yeah, I think adversity brings out the best in people. And for communities, once you get through adversity, you realise how strong you can be. And I think so we'll be a stronger.
Excellent. Thank you, Greg. Norman?
Just remember that what we've discovered in this time is that we've learned what counts. And what counts is each other.
Thank you, Norman. And Lucy?
Look, I think in social psychology, they talk about individualistic and collective communities. And Australia's often been bucketed in with a lot of the Northern Hemisphere as being very individualistic. And what I've actually seen is we're incredibly collectivist in many respects. Our behaviour has been very mutually supportive of each other. The public policy that we're seeing, the economic policy, social policy at the moment is really around a strong collective model of care and concern for each other. And I think actually what we're seeing is that we are a somewhat unique place in the sun, perhaps us and New Zealand, in saying, yes, we celebrate excellence and individual achievement, but when it comes to the crunch, our spirit of volunteering, our spirit of contribution is really coming to the fore, and that's what's got us to this point and hopefully will take us through.
And we know, Lucy, will have achieved it when we all share toilet paper rather than hoard it.
Yeah,
You've crossed a line here.
Well, we've covered a lot of ground and the challenge still lies before us. That's all we have time for tonight. Thanks to Lucy Brogdon, to Greg Jones, to Dr. Sean Turnell and Dr. Norman Swan for joining us tonight for the first webinar of the Big Ideas Forum. Thanks to everyone for submitting your questions, and I'm sorry if we didn't have time to get to yours. Thanks also to the staff here at Glen Street Theatre and the Community Development team who have been working busily bringing this together. This webinar will be available to view on Council's website in the next week or so, together with all previous forums. Don't forget to check out some of the resources we have available on the Big Ideas page on Council's website. Thank you again, and we look forward to seeing you at the next Big Ideas Forum. Good night.
Thank you.
Good night.